Doctors, when did you say oh no out loud? Had a patient come in complaining of stomach pain. Routine stuff, right? Wrong. During the examination, I'm palpating his abdomen and suddenly feel something that definitely shouldn't be there. Like, really shouldn't be there. I'm thinking tumor, mass, worst case scenarios running through my head. So I order an ultrasound immediately. Tech calls me over to look at the screen and I just blurt it out. Oh no, because there on the monitor is a fully intact cell phone. Turns out this guy had swallowed his phone during a drinking game 3 weeks earlier and just forgot to mention it. The kicker, it was still getting text notifications. We could literally see the screen lighting up inside his stomach during the scan. Surgery went fine, phone was totaled obviously, but dude was more upset about losing his photos than the whole life-threatening situation. Some people, I swear. Third-year resident here. Was doing my first solo appendectomy. Attending was supposed to be supervising, but got called to an emergency. Everything's going smooth. I'm feeling confident, maybe a little too confident. I make my incision and immediately realize I'm in completely the wrong spot. Like, not even close. I'm looking at organs that should not be there for an appendix removal. My oh no was so loud the nurses all turned to stare at me. Had to call my attending back, explain my screw-up while the patient is still open on the table. Most embarrassing moment of my career so far. Patient was fine, we fixed everything, but I still get nightmares about it. The attending still brings it up at department meetings. I've learned to triple-check my anatomy landmarks now, that's for sure. Working pediatric ER. 8-year-old comes in with his mom saying he stuck something up his nose. Standard Tuesday night, honestly. Kids being super vague about what it was, just keep saying, it's small and round. I'm thinking bead, marble, nothing too crazy. Get the scope ready, look up there, it's a tiny battery. Not just any battery, but one of those button cell lithium ones from a hearing aid. These things can cause chemical burns in like 30 minutes. Mom had no idea how serious it was, kid definitely didn't. We had to call an ENT immediately for emergency removal. The tissue damage was already starting when we got it out. Kid was fine in the end, but that was way too close for comfort. Now I always ask specifically what they stuck up there before I even look. Lesson learned the hard way. Orthopedic surgery attending here. Had a routine knee replacement scheduled. Everything prepped perfectly. Patient's been planning this surgery for months, took time off work, family flew in to help with recovery. I make the first incision and immediately hit bone that feels wrong. Like really wrong. Stop everything, take an x-ray right there on the table. Turns out the MRI we've been using for surgical planning was from a completely different patient with the same last name. This guy's knee was in way worse shape than we thought. Completely different surgical approach needed. Had to wake him up, explain the situation, reschedule everything. The look of disappointment on his face when I told him we couldn't proceed was heartbreaking. Mix-up was on radiology, not my fault, but I still felt terrible. We got it sorted the next week, but man, that was a rough conversation to have. 2 a.m. emergency surgery. Guy comes in with severe abdominal pain. Suspected internal bleeding. Vitals are dropping fast. Get him into or stat. Open him up expecting to find a ruptured spleen or something typical. Instead, I find glitter. Everywhere. Like someone had a craft explosion inside this man's abdomen. Turns out he'd been eating glitter for TikTok videos over the past few months, and it had been accumulating and causing microperforations in his intestinal wall. Though no, just slipped out when I realized what I was looking at. Spent 4 hours picking sparkly bits out of his internal organs. He survived, obviously, but his recovery room looked like a unicorn had exploded. Nurses were finding glitter on their scrubs for weeks. Social media is going to be the death of us all, I swear. Dermatopathology consult. Fairly routine skin biopsy from what was supposed to be a suspicious mole. Slides come back from histology, and I'm looking under the microscope expecting maybe some dysplasia, possibly early melanoma. What I see instead makes me say, oh no, out loud in an empty lab at 11 p.m. This wasn't melanoma at all. It was necrotizing fasciitis that had been misdiagnosed as a skin lesion for 3 weeks. Patient had been walking around with flesh-eating bacteria, thinking it was just a weird-looking mole. Called a referring physician immediately. Patient was in emergency surgery within 2 hours. We caught it just in time, but another few days and they would have lost the entire leg. Sometimes the routine cases are the ones that surprise you the most. That patient sends me a Christmas card every year now. Anesthesiologist here. Patient's going under for routine gallbladder surgery. Everything's normal during pre-op. I start the induction and suddenly all his monitors start going crazy. Heart rate through the roof, blood pressure tanking, oxygen sats dropping. My immediate thought is anaphylactic reaction to the medication. I'm scrambling to push epinephrine, calling for help, the whole 9 yards. Surgeons asking what's happening. Nurses are running around grabbing emergency drugs. Then I notice patient's phone buzzing on the side table. Turns out his girlfriend had just texted him breaking up with him right as he was going under. Kid was having a panic attack while unconscious. Never seen anything like it in 15 years of practice. We had to wake him up, let him process the breakup news, then reschedule the surgery for the next day. Medicine is weird sometimes. Trauma surgery. Guy comes in after motorcycle accident. Pretty standard injuries, road rash, possible internal bleeding. I'm doing the initial assessment and notice something weird sticking out of his leather jacket. Pull it aside and there's a tree branch. Not like a twig, a full branch about 3 inches thick, completely embedded through his back and coming out his chest. Somehow missed all major organs and blood vessels. It was like someone had threaded a needle with a tree. Though no, it was more amazement than panic, honestly. Patient was completely stable, talking normally, asking if he could keep the jacket. We called it the luckiest motorcycle accident we'd ever seen. Branch removal took 6 hours, but he made a full recovery. Still rides motorcycles apparently, but now he avoids wooded areas. Family medicine, routine physical for a 45-year-old guy. He mentions some weird symptoms, but nothing that raises red flags initially. I'm listening to his chest with my stethoscope and hear something that definitely shouldn't be there. Sounds like music. Very faint, but definitely recognizable tune. I stop, listen again, same thing. Ask him to hold his breath, music stops. He breathes, music starts again. Turns out he'd had a pacemaker installed 6 months earlier and somehow was picking up radio signals from a local station. His heart was literally playing the oldies. Cardiology had never seen anything like it. The fix was simple, but the patient thought it was hilarious. He kept asking if we could tune it to a better station. Made my whole week, honestly. OB delivery, first-time mom, everything progressing normally. Labor's been going for about 12 hours, finally ready to push. I'm getting ready to catch the baby when suddenly I realize something's very wrong with my calculations. Check the chart again, double-check the due date, and this baby is coming 6 weeks early, and we're not prepared for a preemie delivery. NICU team isn't even on standby. I'm trying to stay calm while internally freaking out, calling for backup, preparing for complications. Mom's pushing, baby's coming whether we're ready or not. Turns out mom's dates were just way off. Baby came out perfectly healthy, full-term size. Just looked at us like, what's all the fuss about? Mom had miscounted her last period by almost 2 months. Never trust patient-provided due dates without confirmation. Psychiatry resident, doing an intake evaluation on a new patient. Guy seems pretty normal, talking about mild anxiety, work stress, nothing too concerning. About 30 minutes into the interview, he casually mentions that he's been having conversations with his deceased grandmother every night for the past 2 years. Just drops it into conversation like he's talking about the weather. I try to stay professional, but internally I'm like, oh no, this is way more serious than anyone realized. Turns out he'd been having full-blown auditory and visual hallucinations but never mentioned it to anyone because he thought it was normal grief. His family had no idea. We got him stabilized on medication pretty quickly, but it was a reminder that sometimes the most important information comes out in the most casual way. Radiologist here. Reading a chest x-ray for what was supposed to be a routine pneumonia follow-up. Patient's a 28-year-old healthy woman, should be a quick read. I pull up the images and immediately see something that makes my stomach drop. There's a huge mass in her chest that was completely missed on the previous reads. Like embarrassingly obvious mass that should have been caught months ago. I say, oh no, loud enough that my colleague in the next reading room asks if I'm okay. Have to call the referring physician immediately. Patient needs oncology consult ASAP. Turns out it was treatable, caught it early enough, but the fact that multiple radiologists had missed this thing for 6 months still keeps me up at night. Double-checking everything now, triple-checking the obvious stuff.